This program has been a really amazing experience for me. For one, being able to shadow preclinical medical students and clinical medical students and really see what that experience is like of being in medical school, and also being able to interact with patients in a clinical setting, which is something that I had never experienced before. Before I came to Stony Brook Home, I had some shadowing experience, but I didn't really get to interact with patients one-on-one the way I do here, getting to see how a physical is performed and how social history is taken and really learn about why the patients also came here. You really get to see how Stony Brook Home is unique and and really giving back so much to the community and people who really need medical care, who have no other place to go. I think I've had a very positive experience here because when I actually shadowed the nephrologist I shadowed, it was hard because he's a doctor, so it's different when you're shadowing. Like here, I get to shadow clinical students and preclinical students who are in med school, so I think they're very much aware of being a pre-med student, what you should know, what you should know, what you should learn, what you probably don't know anything about. I think it's like there's like a different type of dynamic, a different type of relationship that you would have with shadowing a doctor, someone who's much older, someone who's already, you know, finished with residency and has been practicing for a while than someone who's in medical school. So a student in medical school not very long ago was in the same position that I'm in, and so I feel like they can really relate and understand like what I would want to know and what I should know. There are actually a few cases that have stayed with me that stick out in my mind that I still think about. Actually, the first time I came here, there was a patient who was diagnosed with diabetes here, and the patient actually hadn't been to a doctor in, I think it was 10 years. So that, I guess, for me, that was a very powerful experience because, in this, with my background and my privileges growing up in this country and having access to healthcare and having the privilege of having medical insurance, I can't imagine, going 10 years and not being able to see a doctor. And this patient actually came to the United States and hadn't seen a doctor in so long, and fortunately there are places like this that exist where even if you don't have health insurance, you can get medical care. And so the patient was actually diagnosed with diabetes here, which that was a moving experience. Stony Brook has really helped me a lot in terms of there's a lot of groups for pre-med students, and there's a lot of opportunities for you to work with other students that have the same interests and give back to the community. Like for one group that I was in, I was able to volunteer at a soup kitchen and volunteer at the veterans home and do things with other Stony Brook students who have the same interests as me and things that I might not have heard about if it weren't through Stony Brook, because Stony Brook really set everything up. Well, I think that I was picked because it's really where my interests are, and it's really what I'm passionate about, and one of the things that I want to do in medicine. My advice for anyone who is applying is really to read a lot, learn as much as you can about Stony Brook Home and the work that's done here, and just be very honest in your application and really think about what you want to do in medicine, what type of physician you see yourself being in the future, and why you would benefit from this program.